Hello, I'm Teresa Cope and I'm the Chief Executive of Manx Care. Thank you for watching this video, and over the next few minutes some of our remarkable people will be talking about our achievements over our first year and against our strategic priorities of improving quality and patient safety, improving the culture of the organisation and improving the financial health of Manx Care. Manx Care launched on the 1st of April 2021 in very challenging circumstances. We were in the middle of another lockdown, and during the course of the last year we've had to deal with very high numbers of COVID positive transmission in the community and admissions into hospital. During this time, a lot of our staff have also been affected by the virus. It has proven a very challenging year, which actually makes our achievements during the first year all the more significant, and that is thanks to the dedication, commitment and care of our staff, who have ensured that during these difficult times we have continued to progress and improve and deliver against all of what we said we would do during our first year. I would like to thank our staff and would like to hand over to them to talk a little bit more about what they've achieved.
Hi, I'm James Watson. As Teresa just mentioned, early in April 2021, COVID ripped through our services. And one of the things that I'm really proud of is the strength of our relationships with the networks in the UK. At the peak of demand for our services, when we were really struggling with a staffing point of view to meet the demand, we reached out to the Cheshire Merseyside Critical Care Network for assistance. As a result of our strong relations we built up over years, Cheshire Merseyside leapt to our help and supplied clinical staff, nursing and anaesthetists to support our critical care unit. One thing that's really struck me over the course of last year is the strength of our relationship with our networks in the UK and how they've flourished through COVID-19. That relationship continues today as we recover our services and drive for better care for our patients on the Isle of Man.
Hi, I'm John Snelling and my background is in general practice. It's interesting today that we're sitting outside Nobles Hospital because what I want to talk to you about is the process of change that Manx Care is undergoing at the moment. Lots of people are calling it transformation. You'll hear that word bandied around quite a lot. What we're trying to do is to integrate health and social care, bring things together so that we're delivering more and more services in an integrated fashion, hopefully closer to your home. That means that you're going to see quite a lot of change, particularly moving services from Nobles Hospital into a community setting or into a setting in your surgery or nearby your home in another building. Two examples of integration that I want to talk to you about today. Firstly, skin problems. We are in the process of training a number of GPs who have a particular interest in dermatology, skin conditions, and they will become specialists in primary care. And that means that many of the services which previously will have been delivered here at Nobles or elsewhere, Ramsey for example, will now be able to be delivered, particularly with regard to skin conditions, in your local surgery or close to your local surgery in your hometown. So that's one way. One of the other ways that I want to talk about is the integration, the bringing together of primary and community care. Primary care is generally things like your GP and your practice nurse. Community care includes our district nurses and our specialist nurses who work in the community. Bringing all of that together under one leadership means that we can work closely together, use the same systems, have a shared record of care, and hopefully that will mean a more efficient and more specified, clever treatment delivered to you close to your home. It's a powerful step forward, and we're looking forward to the change that it brings in the coming months and years.
June was the month that we delivered the 100,000th COVID vaccine on the Isle of Man. This was such a momentous day and testament to the incredible effort our teams have made to get as many people vaccinated as possible. The COVID vaccination programme has been a standout success across the year, and so many of our colleagues deserve credit for stepping out of their day jobs to join the vaccination effort. We're currently working on the Spring Booster campaign and vaccinating children aged 5 to 11 to help protect the most vulnerable members of our community. To date, we've delivered more than 195,000 vaccines. In June, we also went to town embracing Pride.
So in July, we had an issue with the 2-week wait performance for breast cancer. It's important that these people are seen within the 2-week wait to carry their diagnostic journey forward. So what we did is, whilst we are recruiting quite ferociously within the diagnostic area, what we did was we engaged with Spire on the Wirral to enable patients to go away for their diagnostic treatment so that they would meet their cancer target and their cancer journey.
So I suppose this heralded the start of a wider programme of transformation for cancer services and developing the relationships with our tertiary centre colleagues and trying to ensure that our level of care on the island for cancer patients was in line with those in the North West and our Cancer Alliance. We've developed excellent relationships with the Clatterbridge Cancer Centre. Teresa Cope, our CEO, is now a member of the Cancer Alliance board as well. So we're developing those relationships to better improve cancer services.
As a care group, I'm really proud of the progress that we've made within diagnostics and cancer services, the recruitment progress, succession plans to build the resilience, the partnership alliances that we're forming. There's a lot of work to do, but I'm really proud that we're going in the right direction to deliver better services for the people on the Isle of Man.
The 12th of July 2021 was a very special day for us here in Maternity. We welcomed back Bonnie Papa, who was the first baby born in the New Nobles Hospital, to help her celebrate her 18th birthday. She was the first baby born here at the New Nobles Hospital. It was a really good opportunity to have a look back at how maternity services have changed over the last 18 years and to take some time out to celebrate. And of course, here at the Jane, we never need an excuse to have cake. Maternity services in the United Kingdom are currently undergoing a review following the publication of the Ockenden Report. The Ockenden Report was an independent review of maternity services, and here at Manx Care we are also reviewing our service in line with these recommendations, and we are investing a lot of resources into an action plan to help our maternity service meet the standards. The Integrated Women, Children and Families Care Group are reviewing all our services in order to ensure that they are as integrated and as family-centred as they can be. This includes our sexual health service so that we can ensure we have a true integration and joined up services for all who need them. During the last year, the maternity service has also focused on how it can help support new parents. One of the things we have introduced is the Rainbow Care Service for women who have experienced a loss of their baby during pregnancy. This Rainbow service is designed to help women in subsequent pregnancies by providing them with an extra layer of support to reduce anxiety. The maternity unit has also taken part in several activities over the year to remember our babies that were born sleeping. Here on Maternity, we're also focused on the future, and we are proud to welcome our first Manx-trained midwife. Jess is an island resident who secured a place at Salford University on a midwifery degree. We are privileged to be able to work with her in her practical education, and hopefully when she qualifies, she'll be back to join us as a midwife.
August saw the launch of MCALS, the Manx Care Advice and Liaison Service. This is the first time members of the public have had the opportunity to have their healthcare needs addressed across all health and social care settings. This fantastic service for the public. Your feedback's really, really important to us, so it's vital that you get in touch with us. We can help shape services for the future. MCALS has been so successful recently that we've now become a permanent team, which is fantastic news. So please do get in touch today. We really look forward to hearing from you. Thank you.
In September, we began to lay the foundations for our Elective Restoration and Recovery workstream. This workstream aims to reduce our waiting lists caused by COVID-19 and other factors. With Treasury funding of over £1.8 million agreed, we began this work in earnest. You'll hear more about it later.
Hi, I'm Dave Scambler, one of the senior paramedics from the ambulance service. In September, we launched defibs.im, which is an online mapping and registration system to view defibrillators on the Isle of Man. This was a real labour of love, took many years to come to fruition, and I was assisted with colleagues from GTS. This project is really going to save lives on the Isle of Man.
October we celebrated the 40th anniversary of Cummelmore Residential Home in Ramsey with a Ruby themed lunch. A lot of the preparation had been done by staff and residents working together, and it was a really wonderful celebration because it came at a time when things had been particularly difficult through COVID. So it gave everybody a really wonderful lift. Cummelmore is an integral and important part of the northern community, and we had lots of guests there who really enjoyed the afternoon and the event itself. It was nice timing because it kind of says goodbye to the old Cummelmore building in a way. From January 2022 we submitted a planning application for the new build on Waterloo Road on the old Coolmary site. Everyone's really excited about our new build. It will continue to be a vibrant and important part of our northern community.
In October, we started our recruitment for trainee nurses, both adult and mental health trainees, which we deliver here on the Isle of Man. As people know, there are shortages of clinical staff all over the world. We started in October to respond to that by increasing and expanding our international recruitment to help close some of those gaps and provide care to people who need it. We've partnered with a specialist agency called GTEC, who are a strategic partner, and they will source candidates for us on our behalf. And so far we've welcomed 6 colleagues from India and across Africa, and we have more in the pipeline. And these colleagues complement our much valued team members, also from the Philippines, to help build a team of people able to provide care here on the Isle of Man.
The wellbeing partnerships are becoming established across the island now, and the wellbeing partnerships offer a single point of access to all health and social care community services. They are an organisation of partners. There's Manx Care, other government departments and the third sector are all partners in it. And the basic principle is they offer a localised single point of access to all health and social care services. So the North is up and running. We also plan the official launch of the South, which means the South is now fully up and running with a counter service, everything that you would expect. And from that we'll be moving on to the East.
Hi, I'm Gregor Peden, the Chief Clinical Information Officer for Manx Care. Something I'm particularly proud of from December of last year was the implementation of Smart Page, making Nobles one of the first hospitals in the world to become pager-free, even for emergency group alerting. This first-of-type smartphone-based solution eliminates the need for pagers altogether and improves response times to the most urgent of calls. It gives our staff the ability to use two-way instant messaging and structured communication to enable rapid clinical decision-making and faster patient care. We've worked in collaboration with Alcidion, an external technology solutions partner, on the development of this product. And this is just one way in which we've invested in the development of our digital capabilities across Manx Care this last year, which of course we continue to do.
Hi, I'm Kenny.
Hello, I'm Gary.
Hi, I'm Elaine and we're the Blood Clinic team.
In December, our comms team ran a campaign called 12 Days of Manx Care Christmas, shining a spotlight on the huge number of teams and colleagues we have across the organisation and recognised our hard work. We were featured and we were absolutely blown away with the public affection for us. Thank you very much.
I'm Dr. John Thomas, the college tutor at Nobles Hospital. I'm pleased to note that in January, Isle of Man Nobles Hospital was selected as the #1 hospital among 170-odd hospital trusts across the whole of the UK. This is due to the excellent teaching and clinical experience our staff and the postgraduate department here was able to impart to these junior doctors. And we hope to maintain this standard in the years to come.
In February, we began to see some real progress in the restoration and recovery of our elective activity programme. By the end of February, we had managed to clear the backlog of patients waiting for endoscopy procedures, and this was done in-house by our own staff with a huge amount of work and effort, and we managed to have 450 patients through for the procedures, so it was a real success. Across the rest of the month then, there were 150 patients who received their cataract surgery, with 350 patients being pre-assessed in partnership with Synaptic.
One of the things we're most proud about is the collaborative relationship we've developed with Minds Matter to deliver psychological therapies to over 140 children and young people over the next 12 months. This will really enable us to address our waiting list whilst ensuring that children and young people are provided with the psychological therapy that some of them most clearly need. So this is just one of many initiatives we've got planned over the coming year. We're really excited to be able to share those with you. We're really sure that they're going to make a fundamental difference to the way that we deliver care and treatment on the Isle of Man.
As part of the Sir Jonathan Michael review into healthcare on the island, one of the key recommendations was to establish a 24/7 air bridge service to take patients from the island to critical care facilities across in England. In March we launched a 6-month trial with our Great North Air Ambulance colleagues, providing a helicopter emergency medical service, a HEM service, to support patients here on the island.
We delivered the last of our public engagement sessions looking at long COVID, ME and chronic fatigue syndrome as we start to plan to develop and implement this service from later on this year with new funding. We have also put new funding into our end-of-life and palliative care services and are redesigning those patient pathways and services in conjunction with Isle of Man Hospice. These are all key priorities for us over the next 12 months. And you will see further priorities identified within our required outcomes framework, which is a comprehensive document which sets out Manx Care's strategic priorities for 22-23 and describes how we will implement those priorities over the next 12 months. It is a comprehensive read, but I would ask you all to review this document. This will be what guides us in how we respond to our mandate for 22-23 and continue to improve our services for our patients, service users and their carers. Our first year was incredibly challenging, and that required us to go back to Treasury for additional funding, which was supported. This was because we faced a position of rising drug costs, rising patient costs and the costs incurred responding to COVID. We have put in a huge amount of work over the last 12 months to ensure that we understand our finances and can control our finances accordingly. All of our staff have played a really important part in that piece of work, and I would like to thank you for your contribution and your ongoing commitment to ensuring that Manx Care has good financial health. Secondly, I want to highlight the performance of our pathology team, who do not only deliver an incredible number of COVID results, but delivered a staggering number of other tests too during this time, which has been a crucial part of our patients' diagnostic journey. It's important to highlight the huge range of services that this team provides and how much work from teams like pathology underpins the care we deliver across the organisation every day. We launched our Team of the Month initiative to highlight the teams who've gone above and beyond in their efforts to deliver exceptional patient-focused care, and you can see some of our winners on screen now. Finally, during our first year, we were unfortunate to lose a number of our dear colleagues who had dedicated their life to working in health and care. And I would just like to recognise their contribution and the role they played in the first year of Manx Care. I would describe year one as a real year of discovery. There were many challenges, but during that time we have achieved an awful lot. As we move into year two, we will build on those foundations and continue to strive to provide the best possible services for our patient service users and their carers. Thank you all for your contribution to this. Please do continue to help us shape our services and make them the best they can possibly be. Thank you.